Charles, if you had to narrow it down, what number should every woman know?
Know your A1C.
Know your A1C. I was like, where's my pen so I can write this down? It's okay, it's recorded.
Know your blood pressure.
A1C, blood pressure.
Know your blood pressure readings.
Okay.
Definitely have an annual CBC just to know if you're anemic.
That's your blood?
It's called a complete blood count.
Complete, yes. Okay.
And your doctor will usually do a chemistry test on you, which is a basic chemistry or a comprehensive chemistry, but it lets you know what your kidney function looks like, what your sodium potassium looks like. And if they do the comprehensive, they can do more tests to look and see if you've got anything like fatty liver and things of that nature.
Okay.
But always keep track of your symptoms. Know what your baseline is for you as a person. That's the most important thing. What's your routine in the morning? Do you drink water? Do you drink caffeine? How that caffeine affects you?
Yeah.
Know those things.
Know those things.
That way, when you have any variance, you've got to be able to put an event or something that's happening to be the cause factor of it. So if you got a headache, why do I have a headache today? Oh, I drank all that caffeine and ate all that chocolate the other day.
Right. And now it makes sense.
Now it makes sense. Or I had the flu. Right? Or I had the flu. The flu's got me feeling bad, and why do I have diarrhea? Why do I have XYZ going on? So that you can kind of correlate those things and say, hey, this is not a chronic event that's causing, or not a disease that's manifesting.
Right.
It's really the event that's causing it.
Yeah.
And when you have those things go on that kind of linger around, that's when you go to your PCP. Definitely at certain ages now, I would even recommend after 35 years of age, make sure you're checking your breast for lumps.
Yeah.
Please.
Yeah.
I just lost my sister-in-law to it.
Oh, so sorry. I literally just had my mammogram yesterday.
Yeah. Have that done, because
Yeah.
you gotta know when your body changes. It's just like an old car needs more maintenance. You've got to do a little bit more maintenance. But you won't live to 90 years old haphazardly.
Yeah.
If you don't plan for that now, like you're doing the exercises now, you won't live to that age.
Yeah. That's so, and use these. Use your
Absolutely.
phone. Use your phone. We have a notes app. Go into your notes
Yeah.
app and put your notes. Say, hey, record the date.
Yeah.
This date, I'm not, wasn't feeling too well. This date, had migraines, had whatever. And then you can start making those associations yourself. But the goal is that, like you said, you're creating that baseline so that you know.
So that you can communicate that to your provider. Because
Yeah.
when you go to your doctor, you ain't got much time.
Yeah, you have to flip through those. I know I'm always like this with my notes. I'm like, so I have a question about this. Yeah, like it makes sense. And why do women delay care when something's wrong?
Because they're so used to carrying the burden.
Yeah.
The greatest gift is their greatest weakness.
Oh, yeah, that's true. That's so true. And how can women advocate for themselves without fear of being dismissed? Because that's one thing I feel like me and my friends talk about a lot is the fact of, even with your parents in an appointment, making sure that like their concerns are not dismissed.
Yeah. At the end of the day, it's our job as advocates, the healthcare workers, to explain it to you in a way that you understand.
Yeah.
It's like if I gave you a piece of heavy machinery and you go, well, I don't know how to use it.
Yeah.
That's the same thing complex information is. I need to explain it to you in a way that you can not only understand it, that you can apply it to your life.
Yeah.
That's what discharge instructions are for. That's what follow-up instructions are for. To say, hey, here's the next steps we're going to do to improve the condition that you came in today for.
Yeah.
Who am I supposed to see next? Is it a specialist? Am I supposed to have lab tests done? Am I supposed to have an x-ray done? What am I doing, and what's the ultimate goal? What's the objective for me, doc? It's for me to get my blood sugar down XYZ in 3 months, 6 months. When am I following up with you? When are the test results going to be given to me? The information is the key to you being able to manage and change your life, to make those changes. Because I told the patient the other day, I said, listen, either you change your life or your life will change.
Will change. Yep. That is real. That's a good one. Either you change your life
or your life will change.
Or your life will change.
Yeah.
If that doesn't hit you like a ton of bricks. And what's your final message to Black women about their health?
Final message to Black women is
not only we love you, girl, but
we love you. We love you. Human beings are forced into health compliance through the manifestation of disease. So either you're going to figure it out, or the disease will figure it out for you.
Yeah.
It's not an option.
It's not an option.
It's really not an option.
I mean, and when we think about anything, what do they say? When you have a big objective, how do you eat an elephant? One bite at a time.
One bite at a time.
You do not have to go running 5 miles tomorrow.
No, small steps.
Just small steps. Whether it's like we said, right, 30 minutes before bed, you're taking some weights.
Yeah.
And you're going like this, burning that glucose. I know something new now, burning that glucose.
But I'm gonna give you this tip. The quickest way to burn glucose out of your system is do squats.
Really?
Get a chair in front of you and do squats. It's a large muscle group. Your thighs are the biggest muscle group in your body.
Yeah.
They'll burn that sugar up like that. Squats is the quickest way to burn glucose.
So let's just do some squats before bed, ladies. Just sit in front, pop 10, and then go to bed.
Go to bed.
I like that.
Yeah.
And actually, that probably helps with sleep just because you're doing something a little physical.
Bingo.
And then yeah.
Yeah.
Okay.
Let your body reset.
You're the best, Charles. Thank you so much.
Thank you for having me.